Hello, Saint Lucia. Thank you for joining us on another episode of Uncut. I am your host, Lisa Joahil. Today we have in studio Dr. Franklyn Bray, who is a psychotherapist and who will be talking to us about the hot topic, mental awareness in Saint Lucia. Don't go anywhere. Stay tuned. Welcome back. You're watching Uncut. Today we have in studio Dr. Franklyn Bray, a psychotherapist. Dr. Franklyn, thank you so much for joining us today. We're so happy to have you. We know it's been a long time coming, and we knew that we just could not delay this conversation any longer.
Thank you.
So, Dr. Bray, please tell our viewers at home what motivated you to become a psychotherapist, and also help us understand the distinction between a psychologist and a psychotherapist, please.
Okay. Well, let me first thank you for allowing me to be here, to be part of this conversation. That would enhance our perception, our understanding of what obtains in the mental health field in Saint Lucia. What led me to into psychotherapy work or mental health work. I've always been fascinated by the work of the mind, how the mind works, the composition of the mind, how people think, why we behave the way we do. I'm always interested in knowing how to solve problems that appear to be very complicated. And I came to the conclusion that if we can work with human beings and help human beings understand themselves, why we do what we do and what motivates us to do what we do, then of course we can help deal with a lot of our social ills. So the mind really captivated me, and that in itself drove me to that. So I'm very much intrigued by what obtains in the mind. So I pay attention to different illnesses that obtain in life, and how many of them, if not all of them, seem to have some genesis in the mind.
Okay. So what's really the distinction between a psychotherapist and a psychologist?
Every psychologist would be trained in psychotherapy, because psychotherapy focuses on providing principles to help regenerate the mind and dealing with stressors or social issues that seem to trigger misbehavior or adverse behavior in individuals. For example, stress management, anxiety, depression. So every psychologist would have had some training in psychotherapy. However, some psychologists focus on other things. Some psychologists may focus on industrial issues, organizational issues, some on dealing with mental health issues. The opposite, the psychiatrist, who is a trained medical doctor, focuses on psychiatry, which takes in the prescription of medication, even understanding the mind, and maybe training psychotherapy as well, but may not be as in depth as the one who focuses on psychotherapy. So there's a relationship between the psychologist and the psychiatrist and the psychotherapist. They all focus on the same things.
Okay, so thank you for helping us understand that. Yes. So we really want to talk about mental health and awareness in Saint Lucia. I'm quite certain that you have seen a lot of cases pop up all around, with a lot of young persons resorting to suicide or crime and violence because they are bombarded with so many things all around them. They don't know how to deal. So I really want to understand what categorizes, what would make someone understand that someone is suffering from a mental health disease, where they could be some sort of, what you call it, medication that can help them to get to a point where they can improve. And what's the distinction between that and someone where there's really no turning back? Like, people say they've gone crazy, for want of a better medical term.
Right. I'm happy you use some terms in here which tend to be part of the stereotyping, the stigma attached to mental illness. every one of us, because we have a brain, would at some point in time experience some level of stress, or may have mismanaged stressors that we experience, may at some point in time experience some level of depression. But not everyone who experiences depression would become psychotic.
Okay, psychotic.
So yes, and generally when persons say "ufu and fall," you mad, you crazy, it is always to speak to someone who's experiencing some type of psychotic behavior, or is having a psychotic experience because of the challenge that they're having mentally. But mental health, which is important for all of us, is something that we should appreciate. Knowing how to manage our stressors is part of our mental health. Knowing how to manage the feeling of depression is part of our mental health. Knowing how to deal with how anxious we get about things. If when to have an interview, when you're about to board a flight, when you're about to enter your supervisor's office, knowing that
feeling.
That's correct. So
what is that?
So I mean, those triggers, those feelings that you may have, we all experience those things. But some individuals are not as they are not able to. They don't manage it well. They are not able to deal with the level at which they experience those things, and as a result, they use negative principles to deal with them. For example, a person who, we all have experienced stress at some level or another, all right? And I love the fact that in psychotherapy we emphasize stress management. So if there is stress management, there's stress mismanagement. The mismanagement of stress is what triggers the negative responses. For example, I may be going through a difficult time on my job, and I decide to isolate myself emotionally from those that are close to me, physically isolate myself from my job, not wanting to participate, not wanting to be among the individuals, and I internalize all of those feelings. I don't express, I don't process anything, I don't speak to individuals about how I feel, I don't exercise. I feel holding everything in, and I find myself just reclusing. So what may happen at that point is, because I'm having the conversation in my head, I'm having a conversation with myself, I'm seeking to answer the questions all by myself, I'm seeking to argue with myself rather than having a conversation with someone. It is very likely, if I'm predisposed to some things because of my genetics, my background, that a trigger for me may be worrying.
Okay.
And because I've spent so much time worrying, when I've gotten to a certain point, I may begin to feel a certain way. And I may just say something like, I can't take it no more.
And you do something
and
just
you know what? And I begin to lash out at individuals. I get very irritable. I get irritated at the simplest, what someone may call something very simple. Why is he behaving that way? And it may not
suppress this for so long.
It may not be because that thing really bothered me, but that thing which I'm now going through may be associated with something that I've been through, or that I'm now going through, and I snap. So we all have that we have those experiences that perhaps we are not able to explain, but it's because we have not been able to manage our emotions.
Very dangerous, because I asked this question on Facebook. I usually ask the questions before we start an interview, and somebody said, how do you deal with someone who continues to say, I'm numb? Like, I'm numb, I'm not feeling anything. Right. And I think that's very dangerous, because like you just explained, something so simple could trigger you and you could just explode. So how would you say person should respond or react to, or treat someone who constantly says, I'm numb, I have no feelings, like they never want to talk, they don't want to talk to anybody. And you know, a lot of people don't really talk because they're afraid of how you would look at them. They're afraid to go to their boss. They think they're going to lose their job, or people are going to think they're crazy, losing their minds. How do you deal with persons who continue to suppress their feelings and not want to speak out?
Begin by not shutting them out. Begin by not shutting them out. And I really mean this. Oftentimes when someone says, I'm numb, they may be referring to an experience that they have been through or something that they are presently going through, and they're not able to respond to it the way that they would really want to respond. So I'm numb because of XYZ. I'm numb because I don't want to respond in a certain way that may give a negative impression about me. If I were to respond in that way, persons may think, oh, and again, there are so many stereotypes to individuals behave in a certain way that we tend to color all of those things very quickly. If a person who we think should be very decent and not shouting, we may hear that person shout or use a colorful word, some expletive, and we may say, oh, this person is losing it, this person has lost it. Some individuals express themselves in different ways. So when a person believes that they would not be accepted for responding or displaying a particular behavior, which may not be necessarily illegal, or which may not necessarily be wrong, but it may be out of the norm. It may not be normalized behavior for the average individual. But if a person were to consider it to be abnormal, a person who was going through that feeling, that experience, may not want to say anything about it. They would want to shut it in, keep it in, suppress it.
Now that's where I wanted to come to the flip side of things. You have those persons who say they're numb and then something triggers them and they explode. But you have those persons who fall into anxiety and depression because they constantly feel alone. They're dealing with those problems all by themselves. How can I deal with somebody like that? Because if you don't want to talk to me, I can't get anything out of you. I feel like anything I say to you, you're going to snap at me. Or if I say too much to you, you're not going to want to open up to me. I think there are a lot of young persons in Saint Lucia who are constantly battling with anxiety and depression. Is it because there's too much? Is it the standard of living they cannot afford, living under certain circumstances, family problems, the boyfriends, the relationships, situations at home, bullying? What are some of the factors you see coming into play that lead persons to a state of depression?
All of what you've mentioned can contribute to that. All of what you've mentioned. What I've found in my experience as a psychotherapist, also working with the in the religious sector, what I've discovered is when an individual is not able, whether because of stereotyping or what they may persons think of them, when an individual is unable to openly and honestly express themselves, respectfully, but voice indifference or voice difference, it leads to a person creating an image for themselves that is detrimental to them and their personal growth.
Tell us an image.
They would begin to think of themselves in a particular way. They may project themselves a particular way. They may refer to themselves in a particular way, and it does not always have to be verbalized. The deportment begins, the deportment is a demonstration of what they've already internalized. So they begin to behave in a certain way, but they know that what their outward demonstration is conflicting with what they think of themselves inside, or what they know about themselves inside.
That must be very confusing. I know a lot of persons who are very close to me who have gone through that, and it's really hard because you don't know what to do. You don't know, do I call the cops? Do I bring them to a doctor? What are some of the things that are in place? How can I deal
generally persons who are going through those experiences, they don't want to say anything about it to anyone because some persons may not believe them. A young person who is having a negative experience with someone that they are close to and may want to openly share it, boy, I don't think they'll believe me now. Boy, I don't think.
Come back and tell you, oh, but you lie, or is you not doing that to yourself?
That's correct.
You want that to happen
That's
to
correct.
you.
And now that in itself contributes to what we just mentioned a while ago, being numb. You see me? I have nothing to tell anybody.
Right.
Okay, let me just deal with my issue. I'm nothing to say to you. Because if I say it to you, you won't believe me. Or I've been through this thing for so long that right now I'm not able to respond to anything outside of that. I've just shut down.
So at what point do we notice that, you know what, this is getting too serious? Because I'm not able to say, I might not be in a position to say, okay, I need help.
Right.
But you or a family member might notice some signs. So what are those signs that are very visible that can tell you, hey, we need to get help for this person?
If we pay more attention to paying attention to people.
Okay.
You know, if we listen to people, if we pay attention to the words they use, if we pay attention to the behaviors that are not normal for them, behaviors that are out of character, conversations that are out of character with them. For example, a person who is generally joyous, joyful, always, you know, lively, charismatic, and for some reason you meet up with that person a few days and the affect is low. They don't express themselves in a very happy ways anymore. They don't seem to have this joy about life. If you know that individual, you may say, something is not
but
well.
What about the person who is just normally quiet? Like me, I go straight in my room because I have a lot of work to do when I get home.
Now,
how would
again,
you know that anything is abnormal with
again, that is normal for you to behave that way. Now, if I notice that you seem to be overly excited about some things and you begin to do things that are out of norm for you, knowing you, and that's why it's important that family members pay attention to family members, friends pay attention to friends, and the whole community pay attention to people. Knowing the type of person that I know you to be, I can say something does not seem to be right with Lisa. I think I need to check on her, or I need to talk to her about something. I need to find out why I need to engage in some conversation.
Right. Well, in society today, it's sad I have to say this, but it seems like we don't care about anybody anymore. We're not open-minded and see that this person needs help, so we need to get this person help. But we're going to talk a little more about that. We just need to take a little break, and when we come back, we're going to talk more with Dr. Franklyn Bray.
Thank you.
If you haven't checked out Ram J's Auto Parts yet, what are you waiting for? We stock a wide assortment of older and newer model popular car and SUV parts. Suzuki, Toyota, Mitsubishi, Honda, Nissan, Mini Cooper, and lots more. That's not all, Ram J's also stocks truck and heavy equipment parts. And if that won't help you, we also do heavy equipment rental to keep your downtime at a minimal. Ram J's Auto Parts is located Masad Industrial Zone, Grocery. Contact us 450-0495 or 716-1400 or email ramj35@hotmail.com.
Welcome back. You're watching Uncut, and we are here to talk more about mental health and awareness in Saint Lucia. So before we went on a break, I was telling you that I think people, we just don't care. We don't give a damn about anybody but ourselves, because you are feeding me, you are paying my bills. What you look for is what you get.
Right.
Why have we gone to that extent as a society to not care?
As it relates to mental health, some individuals don't want to know that what they're experiencing may be what someone else is experiencing, or rather, what someone else is experiencing may be their own experience internally that they may have to deal with if they were to accept the other individual. The presence of fear in a number of us tend to stop us from accepting the other individual for who he or she is.
So you're saying that I might be dealing with something that you're dealing with, and
that
I
is correct.
Help you,
that is correct.
I know I'm dealing with it.
That is correct.
It's gonna just open up a can of worms.
That is correct. That is correct. Other persons, you may have to come to terms with who you are. So you know what? I'm not touching this, because if I say anything about that, if I try to help that person, by helping that person, I may expose myself. So let me just stay away from it.
But I am also causing harm to myself, because I am suppressing those feelings and
exactly,
not dealing with them.
Exactly.
So the cycle will just never end.
Exactly. Many persons don't want to speak about mental health because they've associated mental health with madness or craziness, psychotic behavior. Many persons were experiencing anxiety and negative stress behaviors, and persons who are going through distressful experiences, they really don't want to deal with it because they have demonized it. Particularly in the religious sector, you have many Christians. You have many Christians who will not want to talk about stress because they speak about the demon of stress, the demon of depression, the demon of anxiety, and everything has been demonized now.
And they want to cast out the demons, and all that's really happening is just a mental state. There's no
you are responding negatively to the stressors in your life.
And that, I would say, Dr. Bray, is as a result of lack of education. Don't you agree?
Well, I would agree that the lack of information about or knowledge about what mental health is or mental illness is contributes to that sort of behavior. And not only that, it is something negative for the religious individual who does not understand that to accept that I'm experiencing depression does not say that God does not exist. But for the individual who's really religious and has categorized everything as demonic, those types of behaviors as demonic, if they were to come to terms with depression, stress, anxiety, those sort of abuses in the church or in society, it is as if it would be saying God does not exist or God is not real. That's why human beings are going through what they're going through. But we have to understand that chemical imbalance can contribute to something.
But then they tell you fear is not of the Lord, fear is of the devil. So if you're feeling fearful and anxious and depressed, then something is wrong with you.
So now there is a scriptural verse that says God does not give us a spirit of fear, but it is true that God does not want us to be fearful. However, individuals suffer from fear, and a person can suffer from fear for a number of reasons. A person may have gotten desensitized to, may have gone through an experience and got traumatized. As a result, every time I see a dog, I feel that the dog is going to attack me. The dog may very well be the most playful thing. Okay? Every time I see a man, I believe the man is going to beat me up.
Right.
So you know what? I don't want to have any man.
And you think it's because they have not really spoken out to someone
There
like yourself and gotten
there are unresolved issues. I don't want to get married because, you know what, my first engagement broke up, or I just had a divorce, you know what, so all women are the same. So the labeling thing, the stereotyping thing people get traumatized, people get afraid of things. And the same way, it breeds that level of fear that when a person may get close to dealing with a challenge, they get fearful of if they go across that line, they may just, as we say in Saint Lucia, flip. So we now need to help individuals walk through, we have to walk them through the process of getting help so that they can go beyond that line. But they must be willing to deal with it. So it is not true that Christians don't experience depression, they don't experience stress. It is not true that Christians don't suffer from anxiety. It is not true. As a matter of fact, the Bible would help us deal with those things, because anxiety, one of the things that really triggers anxiety is the inability to manage things the way that we wish. Not having control over how we want, what we want, when we want. So if we pay attention to what we're experiencing, we can say to anxiety, you are not going to control me. I know what you come with.
It's really all about education.
Education.
Of another friend, when I asked this question, she said she dealt with this, but there were no resources for her available in Saint Lucia. Now I know we can talk about that a little more. And for her, she went online. She read the stories of other persons. She watched videos, and that is how she was able to recover. So we're talking about what is available in Saint Lucia. I know there's a suicide hotline. Persons might think it's just call the cops 911, 999 and they're gonna get help. But there's not that much out there, or public information, I would say, on these are the resources that are available. Go get help. And I know you worked in this for some time. So if you can tell us those resources that are available and how persons can go seek help if they don't feel comfortable talking to a regular person, a friend, a family member.
Right. I know the mental wellness center, Central Mental Wellness Center, does have a hotline that individuals can call if they believe that they're experiencing some mental illness, or perhaps experiencing an overload of emotions and they would wish to speak to a counselor. Yes, I know, and you get that level of privacy that you need to have. It's a professional.
That is very important.
Yes, it's a professional line, so persons can call. I know many priests and pastors are trained counselors, and I say trained counselors. There are individuals, there are other clinical psychotherapists and that exist in Saint Lucia. The one of the major issues, and I really want to use one of the greatest challenges to getting help in this country is the lack of acceptance for mental illness. We have to accept that mental illness is an illness just as having diabetes.
It is real. It is real.
We have to accept that. We have to come to terms with the fact that just as someone can be predisposed to diabetes, whether onset as a child or onset as an adult, a person can be predisposed to depression. And so we should not cast people aside simply because they're experiencing that. Rather, we should try to embrace them and provide sort of attention that they need. So paying attention to individuals matter. Understanding that since everyone is an emotional creature, everyone can at some point in time go through an experience that way. So persons who are trained in the area should make themselves available to helping those individuals.
And I can see a lot of persons who would be afraid, because I have visited Golden Hope before it was ruined, and it is not the nicest place. You do not want any of your family members. Unfortunately for me, I had someone very close to me in there, in chains, being held down because maybe they were not diagnosed correctly. And it was very sad. It broke my heart to see that person behind those bars. But persons are afraid to be in that situation.
Yes.
So for example, a young woman like myself, I have a career, I have my job. I might be so afraid of what people are going to say. I don't want my family to see me behind bars. So as opposed to a place that should be seen as a place, an institution for refuge that persons can go to seek help, it seems like a prison, it seems like a dungeon. Now, thankfully, the new facility does not look that way, but persons are still of the impression that if I go there, I will be termed or looked at as crazy. So like a professional, a doctor or an attorney who is suffering from some internal with some internal issues, they will not feel comfortable really going to speak out to
and the stigma really continues. We have to fight stigmatization. It is very important. It cannot be overemphasized. We have to fight stigmatization.
And Saint Lucia is small, so everybody know everybody. They're going to point fingers at you when you come out of there.
Well, guess what? There are many individuals in Saint Lucia who suffer with diabetes.
But we don't look at it like that.
And we don't walk around, oh, she has diabetes, or he has. We have normalized diabetes to the point that many persons speak about the reversal of diabetes, understand that diabetes is a lifestyle disease.
Right.
We need to come to terms with the fact that mental illness is one like any other.
But we are under the impression that psychosis, there's no coming back. You take that black joint, for example, or they say your mother or your father do you mal. You know how the old people will say, there's no coming back, because you see these guys on the streets, they're not getting the help that they need. The clock is ticking, they've been there for years and years. People will not feel that there is any solution to this. Like once you go black, you don't come back, in other words.
Well, the reality is that because of the different features of psychotic illnesses, not everyone may, again, based upon what the person's experience is, not everyone would be as, their behavior may not be as normalized as they were before. For example, a person who is predisposed to schizophrenia, and in Saint Lucia there are many cases of schizophrenia. I don't have stats on how many schizophrenic individuals we have in Saint Lucia, but we have a number of those persons. Individuals can live normal lives with schizophrenia. Normal lives. Having a bank account, going to work, driving their cars, buying property, normal lives. However, if they are not treated, if family members shun them, if the institutions shun them, if they are made to feel that they are unable to care for themselves and do things, then you'd have them retreating or being forcefully pushed to a side so that someone else can manage the bank accounts and the children and those things for them. But it's important that they receive treatment.
But Dr. Bray, I don't think the stigma with schizophrenia is as great as stigma attached to psychosis. So I really want to know, you as a psychotherapist, you diagnose, right? How do you determine, or what permits you to allows you to determine that this person is psychotic?
Well, in Saint Lucia, clinical psychotherapists don't prescribe meds. In some parts of the world, in the civilized countries, clinical psychologists, clinical psychotherapists can prescribe medication. In Saint Lucia, the medical doctors and psychiatrists can. There are symptoms, there are signs and symptoms that one would look for. And that in itself would help determine where a person may be in terms of chemical imbalance, or maybe in terms of
so what sort of symptoms? I mean, we don't want to go around diagnosing people because we're not.
Right. So there are some things you may find. For example, a person who may be experiencing drug-induced psychosis may display behaviors that may be consistent with that you may also find in someone drug-induced psychosis as it relates to marijuana.
Okay.
You may find that same behavior with someone who may experience the psychosis because of alcohol drinking.
But these are,
Okay.
I would say, temporary.
Right. Now you may have a person who may be experiencing some level of delusion because of what they believe someone may have done to them, or some dream that they may have had,
Right.
or some level of paranoia that they're experiencing. Now, whereas you don't want to get one card and one label, just put on the individual and say, based upon all of those things, you are. Based on all of those things, you are. You want to have the professional deal with that and be able to help the individual. So there is no need for someone to be afraid of seeking help or going to receive help.
So I'm saying that someone who experienced psychosis, drinking alcohol or marijuana, these are reversible because these are, they're only temporary. But as you will be are familiar with the black joint where they mixed certain drugs, and that takes a whole lot longer period for recovery.
Right.
Is that a situation or an example of someone needs to be admitted to the wellness center?
Yeah. Well, hospitalization does become important for some experiences that individuals are having. For the period of hospitalization would differ, would be different based upon the severity of the situation. A person may have to be hospitalized so that they can receive the treatment until they're able to get reacclimatized to the normal society. Because, and I say normal until the delusion has been dealt with. That's important. So it is not true that there is no need for hospitalization. What many clinical psychologists are against and psychiatrists are against is the perpetual hospitalization of persons with mental illness.
Right.
In other words, once a person is mentally ill, just incarcerate them, not even hospitalize them, just kick them behind bars. That is something that happened quite a lot in the medieval ages. Society has moved away from that. There is a way of reintegrating persons who are receiving treatment for mental illnesses in society. And I believe in Saint Lucia, because of the levels of, I should say, because of the social challenges we're having, because of us promoting ourselves to be a part of the globalized environment, and so many foreign nationals and other persons experiencing mental illness right in St. Lucia, it is important that we begin to frame a conversation about reintegration and not incarcerating or hospitalizing individuals who are mentally ill.
All right.
That's a challenge.
So we'll take a break here, our last break for the evening. And when we come back, we will talk a little more about how we can reintegrate those persons back into society.
Thank you.
Stay tuned.
If you haven't checked out Ram J's Auto Parts yet, what are you waiting for? we stock a wide assortment of older and newer model popular car and SUV parts. Suzuki, Toyota, Mitsubishi, Honda, Nissan, Mini Cooper, and lots more. That's not all, Ramjays also stocks truck and heavy equipment parts. And if that won't help you, we also do heavy equipment rental to keep your downtime at a minimal. Ramjays Auto Parts is located Masad Industrial Zone, Grocery. Contact us 450-0495 or 716-1400 or email ramj35@hotmail.com.
Thank you so much for staying with us. Our guest, Dr. Franklyn Bray, told us so much about what to look for in terms of how to deal or how to manage someone who is very close to you, who is suffering from mental illness, mental health, anxiety, depression, and the like. So we've talked a lot about this, but what I really want to tell our viewers, what I really want you to tell our viewers is how can we move on from this? Because we can talk and talk about this and all aspects of it from now until God comes. But what can we do as a society, as a community, as a church group, as a family, as for our friends and for our loved ones? How can we get those persons back because they've received treatment, and I'm sure they're very scared because they're still concerned about, will I be able to get a job? What about the persons who live near me? Will they want to hold their children when they see me and not want, how would they approach me? So as much as it is fearful for someone who is seeing this person is now coming back into my community, I'm sure the person who is now going back is feeling that sort of these sort of feelings. So talk to us about it.
We would need to, again, I'll say we need to begin thinking of accepting those individuals so that they can become part of society again based upon the severity of the situation. Hospitalization may become necessary for persons may have different psychotic features and all of that. However, shutting them out of society may not be, shutting someone who has experienced some level of mental illness outside of society is not the right thing to do. Those persons, whether they are employers or employees, whatever status you have, society needs to begin to embrace those individuals again, based upon the reason for the hospitalization, again, based upon the type of mental illness suffered. Some triggers would have to be taken care of. For example, a person who had suffered mental illness because of mismanagement of stress may not be of as great a concern to an employer rather, as someone who may have experienced some sort of delusional behavior. Or had a delusional experience. So again, based upon what it is, you would have to deal with the triggers so that person can get reacclimatized into society.
What if this happens again? If you take it once, then you can take it again.
Yes, again the ticking and the fear. But again, persons can live normal lives with treatment. A challenge is that when a person has been sent back into society or perhaps accepted in society, the person may not continue treatment. Not continuing treatment maybe because there's not a family member to assist the individual to help to encourage the person to go back to the wellness center for outpatient treatment.
Is there any follow-up after a visit to the wellness center?
Oh, sure. There is outpatient treatment. There are services for outpatients. There are treatment. There are centers, wellness centers in the different communities. So family members need to play a role in helping those persons go to receive the treatment, follow up, for what they need to follow up on, so that they can continue living a normal life. Outside of that, what you would find is a person escapes treatment or says, "I don't need this. I don't need any more help. I'm good." And they experience some trigger, and again you have the relapse, and the family member says, "You know what, this happens every time he loses the job. This happens every time he gets drunk. So do I get him to deal with drinking? Do I get him help with smoking? What Where do we come in as a family?
Where do we come in?
Right.
Even as a community, what can we do in our
So
because we're not psychotherapists.
So we need to get educated about mental illness. We need to promote mental health. We need to care for our mental health. I'm saying care as in we need to embrace it, see it as something that is valuable to us and valuable to society as well, because it costs us a lot as a nation to have persons experiencing mental illness and not getting the type of treatment that they have. So let's not cast them aside, but seek to integrate them when they have received or are receiving treatment.
Dr. Bray, thank you so much. It was wonderful. It was very lovely to have you on the show.
My pleasure.
Unfortunately, we do not have much time left. Yes. We don't have any time left, but I would love to invite you again so we can continue this conversation.
Sure.
Saint Lucia, there you have it. Instead of casting a blind eye and pushing them away, we need to be more embracing of each other.
Get involved.
That is the only way we can help getting involved.
Yeah.
So thank you so much, and we'll see you next time.
Thank you.
Thank you.